You've been lied to your entire life. They told you masturbation was dirty, that it was something you should have outgrown by the time you turned 50. But here's what no one said. After 60, masturbation isn't just normal. It could be the difference between life and decline. I've spent over 30 years treating men just like you. My name is Dr. Mohit Kara, and I'm a urologist and professor of men's health at Baylor College of Medicine. I've seen the silent consequences of neglect, shame, and misinformation. I've watched too many good men suffer not from illness, but from what they never knew. Because the truth is this: most older men masturbate the wrong way, or worse, stop altogether. They don't realize that how you touch yourself, how often, and with what intention can shape your hormones, your heart, even your brain. Yes, one simple act done poorly can contribute to erectile dysfunction, depression, and even prostate problems. Done right, it can boost testosterone, improve sleep, and keep your vascular system alive. This isn't just about pleasure. It's about preserving function, reclaiming connection, and fighting back against aging where it starts in the nervous system. In just a moment, I'm going to share 7 secrets about masturbation every man over 60 should have been taught decades ago. But first, ask yourself, if one part of your daily routine held the key to better health, better mood, and better vitality, wouldn't you want to know what it is? Stay with me. What you're about to hear might just change the way you live the next 10 years of your life. Before we continue, if you haven't already, take a moment to subscribe and turn on the notification bell. That way, you'll never miss another honest, science-based health insight made specifically for men in your stage of life. And if this message resonates with you, just type 1 in the comments. If it doesn't, type 0. Your feedback helps me create content that truly serves you. Now let's get into it, starting with the first truth most men never hear until it's already caused them problems. Because the way you've been masturbating for years, even decades, might feel familiar, even harmless. But after 60, what once seemed routine can quietly begin to work against you. This is where we begin with the most overlooked mistake older men make when it comes to self-pleasure. It's subtle, it's silent, and over time it can cost you more than you think. Secret 1, mindless masturbation can lead to Secret 1 numbness and ED. Let me tell you something I wish more men had the courage to talk about. Over the years, I've had hundreds of older patients come into my office quietly ashamed, eyes down, their voices barely above a whisper. And after some time, when the conversation turned honest, I would ask, "Do you masturbate?" Almost always, there was a pause, and then came the confession. "Yeah, but I don't feel much anymore." Or, "I can't finish unless I do it a certain way." Or the one that sticks with me most: "It's like my body forgot how to feel." What they didn't know was that the way they'd been masturbating, quick, mechanical, disconnected, had been training their body into dysfunction. And the consequences: quiet, creeping, devastating. Mindless masturbation isn't just a bad habit, it's a neurological conditioning loop. Every time you rush through the act with tension in your shoulders, scrolling through intense images using the same hand, same motion, same outcome, you're teaching your brain to associate arousal with that very specific routine. And unfortunately, the brain is a fast learner. So what happens over time? Your sensitivity drops, your erection quality starts to fade. You might notice you need more stimulation, more pressure, more tricks just to feel the same way you did before. it becomes harder to respond to a real partner. You start avoiding intimacy because it feels too different, too slow, too real. And this is where the real damage sets in, not just physically, but emotionally. I've seen men spiral into frustration, shame, even depression, thinking their body is broken. But in many cases, their body isn't broken, it's overtrained in the wrong direction. This conditioning can lead to something called porn-induced erectile dysfunction, or PI. It can also cause what's known as delayed ejaculation, or in some cases, complete anorgasmia, the inability to climax at all. These aren't rare conditions, they're quietly affecting millions of men. And the cruel part is most of them never realize it's something they've unintentionally done to themselves. But here's the worst part, and I want you to hear me on this. When you condition your body this way and you don't reverse course, it's not just sex you lose. You lose confidence, you lose connection, you begin to retreat. Distance, depression, even the early signs of cognitive decline. I've seen it again and again. The price you pay isn't just in the bedroom, it's in your spirit. It's in the way you carry yourself when you walk into a room. It's in the way you stop looking at yourself in the mirror. You slowly begin to disappear. Now, I'm not here to shame you. I'm here to wake you up. Because the good news is your body can relearn. The nervous system can heal, but it takes awareness, patience, and a new way of approaching self-pleasure, one that's slower, more conscious, and more connected, not just to sensation, but to emotion. Masturbation isn't the enemy, but doing it without awareness is like putting your car in gear and stepping on the gas without steering. Eventually you crash, and by the time you notice the damage, the repair can take far longer than you think. But here's something most men don't realize. While mindless masturbation causes damage, there's something just as dangerous hiding in plain sight, something even quieter, even more common. And it's actually praised by society. In the next secret, I'll show you why not masturbating at all after 60 might be the very thing slowly sabotaging your health from the inside out. If you're still here and these insights are resonating with you, just type the number 1 in the comments to let me know you're still with me. Now let's keep going. There's something important you need to hear next. Secret. Masturbation reduces secret to prostate congestion and inflammation. There's a man I remember clearly from a few years back. Let's call him David. He was 68, proud, reserved, and the kind of guy who didn't like to talk about personal matters, but he came to see me because he was getting up 5, sometimes 6 times a night to pee. He said he felt pressure, fullness, even a dull ache deep in his pelvis. He thought it was just old age catching up. What he didn't expect me to ask was, when was the last time you ejaculated? He blinked at me like I'd asked him something absurd years. He said, I haven't had sex since my wife passed. And to be honest, I thought men my age were supposed to stop doing that. That right there is the myth that once you hit a certain number, 60, 70, you're supposed to just shut the whole system down. But here's what I told David and what I'll tell you now. When you stop ejaculating, your prostate doesn't stop working. It keeps producing fluid, and if that fluid isn't released, it builds up, creating a kind of stagnant reservoir inside your body. That buildup, that's what leads to prostate congestion, inflammation, discomfort, and over time, real health risks. Your prostate is not designed to store fluid indefinitely, and when it does, it becomes swollen, inflamed, and irritated. That's when you start experiencing urinary urgency, weak stream, dribbling, even pain during urination or ejaculation. Most men chalk it up to aging, but in reality, it's a system backed up and under pressure. Here's where it gets serious. Chronic inflammation in the prostate has been linked to an increased risk of prostate cancer. Now, I'm not saying that abstaining causes cancer, but I am saying that frequent ejaculation helps reduce the inflammatory environment that can make the prostate more vulnerable to disease. And there's more. A large Harvard study followed nearly 30,000 men over years and found that those who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer than those who didn't. That's not myth, that's data. But let me bring it back to David. Once we talked, once he understood what was really happening inside his body, he made a change. He began touching himself again, not out of lust or loneliness, but out of care. Slowly, his symptoms improved, the pressure eased, his sleep got better, and more than that, something in his eyes lit up again. He was reconnected to a part of himself he thought had been put to rest. The price of neglecting this isn't just a few bad nights of sleep. It's chronic discomfort. It's medication you might not need. It's surgery down the road. And yes, it could be a higher risk for cancer. All because of a belief that a man your age should no longer claim this part of his health. You wouldn't ignore your heart. You wouldn't ignore your blood pressure. Don't ignore your prostate. Now, what if I told you that the emotional shame men feel around this years of guilt, silence, and discomfort about touching themselves actually makes the physical symptoms worse? Because that's exactly what the next secret reveals. And once you understand the connection between I shift when I ask about sexual habits. The way their shoulders sink when the word masturbation comes up, the way they laugh it off, change the subject, or tell me, "Doc, that's not something I do anymore. That was for when I was younger." But I can hear the subtext. It's not that they stopped because they wanted to. It's that somewhere along the way, they were taught it was wrong to keep going. And let me be honest with you, this kind of shame, quiet and unspoken, is one of the most dangerous forces acting against your health today. For decades, many of you were raised in a time when touching yourself was called dirty, sinful, weak. You were punished, ridiculed, or made to feel embarrassed. And those early messages, they didn't disappear. They just went underground. They sat in your nervous system, deep in your bones, quietly shaping your relationship with your body. Even now, the result is a quiet withdrawal. You begin to disconnect from physical touch. Even when you crave it, you begin to see desire as something inappropriate. You stop reaching for yourself, not because you don't want to, but because you've been conditioned to feel that you shouldn't. And over time, that disconnection becomes more than emotional. It becomes biological, because here's what most men don't know. Regular, healthy sexual touch, including masturbation, supports mental well-being in real, measurable ways. It regulates cortisol, it boosts dopamine. It fosters oxytocin, your brain's trust and connection hormone. It even helps with sleep, mood, and cognitive function. But shame disrupts all of that. Shame tightens your muscles, raises your stress hormones, creates guilt loops in your mind that you don't even notice anymore. Shame is a stressor, and chronic stress, it's linked to anxiety, depression, heart disease, immune dysfunction, and even dementia. I had a patient once, 72, recently divorced, deeply depressed. He wasn't on any medications, no major health issues, but he was exhausted, numb, isolated. He told me he hadn't had any sexual activity, not with someone else, not alone, in over a decade. I just thought that chapter was closed, he said. And underneath his words was a quiet grief, not for the loss of sex, but for the loss of self. We worked together slowly. No pills, no drastic changes, just simple exercises to reconnect him to his own body without guilt, without expectation. After a few weeks, something shifted. He started walking taller. He was sleeping better. He laughed again. His blood pressure came down. He wasn't fixed. He was reconnected. That's the price shame asks of you. It takes your vitality one slow inch at a time. It tricks you into thinking you're too old to feel alive, but you're not. You are never too old to touch yourself with kindness, with dignity, with purpose. You are never too old to feel whole. And if shame can do that much damage, what do you think happens when hormonal decline adds fuel to the fire? Because the next truth is one most men never see coming. Your testosterone doesn't just drop because you age. It drops faster when you stop engaging with your sexual self altogether. And once that hormonal balance begins to tilt, it affects far more than your sex drive. It changes how you think, how you move, how you live. And that's exactly what we're going to uncover next. If you're still with me and finding this valuable, type the number 1 in the comments to let me know you're here and engaged. Now let's continue with the 4th insight. This one may surprise you. Secret 4. Testosterone is stimulated by sexual secret 4 activity, even solo. I want to tell you something that most men only find out when it's already too late. Something I wish every man over 60 could hear clearly without embarrassment or doubt. Testosterone, the very hormone that fuels your energy, strength, drive, confidence, and sexual desire, doesn't just slowly fade away because of age. That's what you've been led to believe. But here's the truth. I've learned after decades working with men just like you. Testosterone also drops when you stop living like a man who still wants to feel alive. When sexual energy is ignored, suppressed, or buried under years of shame and inactivity, your body begins to turn the dial down on its own masculinity. It says, he doesn't need this anymore. And it starts reallocating resources, redirecting hormones, slowing blood flow, conserving energy. Your muscle tone fades, your belly grows, your sleep worsens, and your spark, that edge that used to make you feel like yourself, begins to vanish. Not because you're old, but because your body has stopped being reminded that you're still here, barely above clinical deficiency. And when I asked him about sexual activity, he just shook his head. I don't see the point anymore. That belief right there is the real threat. Not the number on the calendar, but the moment you stop seeing your sexuality as a living, breathing part of who you are. I helped Frank slowly re-engage, not with anyone else, but with himself. Simple practices, no shame, just presence. And over the next few months, not only did his hormone levels improve, his posture changed, his voice carried more weight, he started lifting again. His eyes lit up when he talked. You see, the body responds to what you give attention to. When you ignore your sexual self, your testosterone listens. But when you reawaken it, even through solo intentional touch, you're sending a signal to your brain, I still need this. I still want to feel. And the brain responds by turning systems back on that had been dimmed for years. This isn't just theory. We've seen studies showing short-term boosts in testosterone following sexual stimulation, even solo. We've seen how erotic imagination, physical engagement, and even anticipation can affect hormone regulation, mood, and motivation. Your body is built to respond to pleasure, to connection, to presence. And when you give it nothing, it slowly starts offering nothing back. The cost? It's higher than most men realize. Low testosterone has been tied not just to fatigue and sexual dysfunction, but to heart disease, diabetes, cognitive decline, depression, even a shorter lifespan. It is not just a number, it's a vital marker of how engaged you are with life itself. And the worst part, most men never know how far they have drifted from themselves until it feels almost impossible to get back. But there is a way back, and it begins not with medication or surgery, but with reclaiming your own connection to your body on your terms, in your space, without guilt. This is about reminding your biology that you're still in the game. And if that surprises you, just wait until you hear what I'm about to share next. Because there's something even more critical than testosterone, and most men are quietly damaging it every time they touch themselves the wrong way. Secret 5. Erectile function is a secret 5 use it or lose it system. There's a quiet lie that many men come to believe after 60. It sounds like this: if I'm not having sex, then I don't need to worry about erections anymore. I've heard it countless times, men brushing off concern about their function because they think they've aged out of needing it. But let me tell you something most doctors don't say plainly enough. Erectile function is not just about sex, it's about blood flow, nerve health, cardiovascular integrity, and longevity. I once had a patient, Harold, 69 years old, strong history, smart man, but he'd gone 5 or 6 years without a single erection. Not because he couldn't, but because he thought there was no reason to. His wife had passed, he wasn't dating, and he figured that part of life was just over. What he didn't realize was that his body wasn't just waiting around for him to decide to come back to it. It was shutting things down. Here's what most men don't understand. The penis is like any other muscle and vascular structure in the body. If you don't use it, the tissues lose elasticity, blood vessels stiffen, oxygen flow decreases, micro tears and fibrosis, the hardening of soft tissue start to set in. And eventually, even if you want to use it again, it doesn't respond the way it once did, not because of age, but because of disuse. This is where the cost comes in, and it's steep. When regular erections stop, the smooth muscle in the penis begins to atrophy. The delicate network of blood vessels responsible for engorgement becomes less efficient. Nitric oxide, a vital chemical for triggering erections, diminishes. And here's the part no one tells you. This happens whether you're trying to be sexually active or not. It's biology. If your body doesn't experience regular arousal and engorgement, it assumes the system is obsolete. And over time, the damage is not just physical, it's psychological. Because as the body loses its capacity, the mind begins to follow. Confidence erodes, self-worth slips. You feel less like yourself, not because of age, but because your body is no longer responding to the identity you once carried. For many men, this leads to withdrawal, depression, even early signs of cognitive slowing. I've watched it happen, not overnight, but slowly, quietly, and completely preventable. So what can you do? You can remind your body that it still matters, that physical health and identity, the act of together. But there was something hollow in his voice when he talked about his day-to-day life. He told me he hadn't been physically touched in over a year. Not a hug, not a hand on the shoulder, nothing. He didn't say it with sadness. He said it with resignation, like it was simply a chapter that had ended. What Peter didn't realize was that touch is not a luxury. It's a biological need. The human body, even at 60, 70, 80 years old, is wired for it. When we go too long without physical contact, our nervous system begins to downshift. Oxytocin drops, stress hormones creep in, blood pressure rises, sleep suffers, immune function weakens, and most dangerous of all, the brain begins to shut down emotional and sensory circuits as a form of protection. In other words, when we stop being touched, we begin to go numb, not just physically, but emotionally. We lose a sense of aliveness. We stop feeling the urgency to engage with the world. And the tragedy is this happens slowly, quietly. One day, you're just skipping your routine. A week later, you're avoiding mirrors. A month later, you stop imagining anything pleasurable at all. And here's the part no one talks about. Isolation often starts in the bedroom. When a man stops touching himself, not just for pleasure, but for presence, for self-connection, his brain begins to interpret that as a form of emotional retreat. Over time, that withdrawal becomes self-reinforcing. He touches himself less, feels less, and becomes convinced there's nothing left to feel. That's the real cost. Not just lost erections or faded desire, it's the slow fading of identity, of purpose, of emotional sharpness. It's the quiet death of connection. And this isolation has been directly linked to depression, heart disease, even early death. Not because of age, but because of abandonment. Not by others, but by the self. Now, I want to be clear, this is not about shaming anyone. Life happens, loss happens, distance happens. But what doesn't have to happen is surrender. Because the act of touching yourself, whether it's sexual or not, is not about vanity or habit. It's about claiming your body as still yours, about telling your brain, your heart, your nervous system, I'm still here. I still matter. I still want to feel. I've seen men come back to life simply by giving themselves permission to reconnect, to break the silence, to return, to touch, to wake up the parts that went quiet too soon. And when they do, their posture changes, their voice returns, their spark begins to flicker again. And if you're still with me now, if something in this speaks to you, then what comes next may be the most important part of all. Because now that you've heard the 7 truths no one ever told you, I'm going to show you how to begin again step by step with a simple, powerful practice I give to my own patients. A daily ritual that helps rewire your body, rebuild sensitivity, and restore what time and silence tried to take away. Conclusion. If you've made it this far, I want to take a moment to speak to you not just as a doctor, but as a man who spent decades sitting across from other men, hearing their fears, their regrets, and sometimes their quiet hopes. What we've talked about today isn't just about masturbation. It's about something much deeper. It's about how you relate to your body, how you carry your history, and whether or not you're willing to believe that your life, your sexual life, your emotional life, your physical life isn't over just because the world told you it should be. We started with the truth that mindless masturbation can slowly train your body into dysfunction, that rushing through the motions, disconnected and distracted, isn't harmless. It's rewiring your brain and eroding your sensitivity. We looked at how avoiding ejaculation altogether can lead to prostate congestion, inflammation, and in some cases even increase the risk of cancer. That your body was designed to stay in motion, and when it stops, systems suffer. We talked about the silent poison of shame, how so many men still carry guilt that isn't even theirs. Guilt they inherited from culture, religion, or family. Guilt that has no place in a healthy man's relationship with his own body. We explored how low testosterone isn't just something that happens with age, but something that accelerates when you stop engaging with your sexual self, and how something as simple as solo touch can start to turn that tide. We talked about how your erection isn't just a sexual function, but a sign of vascular health, that it truly is a use it or lose it system, that the cost of ignoring it isn't just in the bedroom, it's in your confidence, your motivation, even your memory. Then we open the door on porn, not to shame, but to explain how it alters your brain's chemistry. That it's not about morality, it's about biology. That what once sparked excitement can over time numb you to reality. And finally, we looked at the most dangerous mistake of all, isolation. When you stop touching, stop being touched, stop connecting in any way, the body begins to pull back, not just from pleasure, but from purpose, from emotion, from life itself. What I want you to take away from all this is simple. You're not broken, you're not past the point, and you're not alone. Every system in your body, even now, wants to respond to connection. Your brain still wants to feel. Your heart still wants to open. Your skin still wants to remember what it means to be alive. And that journey back doesn't require anyone else. It starts with you. It starts with a choice to stop shrinking, to stop apologizing for wanting to feel good in your own body, to stop believing the lie that age makes you invisible. You're not invisible. You're still here. And what you do with that matters. So here's what I tell my patients when they're ready to start again. Not with pills, not with guilt, but with presence. I give them a simple daily practice, what I call the golden protocol, 10 minutes a day, quiet, intentional, respectful time to reconnect with themselves. No agenda, no pressure, just touch, breath, and awareness. For some, it becomes a morning ritual. For others, a bedtime routine. But almost always it becomes a turning point. Because when a man touches himself with care, not out of habit or desperation, but with curiosity, something shifts. His body remembers, his mind softens, his spark returns. And maybe yours can too. This isn't just about reclaiming your sexuality, it's about reclaiming yourself, and that starts right here, right now with you.